How did traditional and modern medicine merge in Latino history? Imagine a healing system that combines herbal teas, spiritual rituals, and modern medicine all in one. That's what happened in Latino communities over centuries. Long before Europeans arrived, indigenous peoples in Latin America had their own ways of healing. They used plants, performed spiritual ceremonies, and relied on community support to stay healthy. These practices were deeply rooted in their culture and daily life. When Spanish explorers and colonizers came, they brought new ideas about medicine. They introduced Western practices like surgery, herbal remedies, and Catholic spiritual healing. At first, these systems were separate, but over time, they started to blend. This blending created a new kind of healing called Curanderismo. It mixes herbal medicine, spiritual cleansing, and modern medical techniques. Curanderos, or traditional healers, became important figures in communities. They often served as herbalists, spiritual guides, and counselors, especially in rural areas where hospitals were far away. The mixing of cultures through mestizaje, or racial and cultural blending, also played a big role. It created a flexible healing tradition that took ideas from indigenous, European, and African roots. People began to see traditional practices as part of their identity, not separate from modern medicine. Even today, many Latino families trust traditional remedies because they are affordable, familiar, and address emotional and spiritual needs. In the United States, Latino immigrants continue to use these practices alongside modern health care. They often see them as complementary rather than separate. Healthcare providers are now learning to respect and include traditional practices. Some clinics work with traditional healers to build trust and improve communication. Education programs teach medical staff about herbal remedies and spiritual beliefs common in Latino communities. Research into medicinal plants used in traditional healing helps ensure these remedies are safe and effective. Combining scientific knowledge with cultural practices creates a more complete approach to health. Overall, the merging of traditional and modern medicine in Latino history shows a resilient, adaptable system. It respects cultural roots while embracing new medical advances. This approach helps people feel seen, heard, and cared for in ways that truly connect with their identity and needs.